Hello and welcome to Better Health Training, presented by Erik Lunt and hosted by General Agent Center. The problem: medical costs are out of control. Medical debt continues to overwhelm American families. As of June 2023, 15 million Americans have medical debt on their credit reports, 49 plus billion currently in collections. Hospital stays are also more expensive than ever. 3,000 per inpatient day on average, with a typical 3-day stay can run 30,000 plus with all expenses. And ACA 2026 out-of-pocket maximums keep rising: 10,600 for the individual and 21,200 for the family. Once these limits are hit, plans cover 100% of in-network eligible expenses, but getting to those limits can be financially devastating. Here's the solution: Better Health added to all your sales. Guaranteed issue work for working individuals and families. Pays in addition to any other coverage with no deductibles or copays. Accident medical expense pays on an excess basis. Available to members up to age 65 with dependent children, child coverage up to age 26 if full-time students. One time per year sickness and accident hospital admission benefit of either 5 or 10,000 per covered family member. Accident medical expense up to 5 or 10,000 per covered family member plus other accident benefits. In hospital sickness and accident indemnity, $250 per day for up to 5 days per year per family member. And the benefits are paid directly to you or the provider, giving you the flexibility and peace of mind. Here are some key benefits. The hospital admission once per year benefit that pays in addition to other coverage is either $5,000 for our Premier and Elite members or $10,000 for our Premier Plus and Elite Plus members. It also comes with in-hospital indemnity 5 days maximum that also pays in addition to other coverage. It's $250 a day for the first 5 days on the Premier Elite, and as well as the Premier Plus and Elite Plus. Additional key benefits: these accident medical expenses for hospital emergency room and confinement pay for doctor and surgeon, lab and x-rays, and ambulance for covered accidents. It also comes with an AD&D maximum benefit of $5,000 with accident medical expense of either $5,000 for the elite level and $10,000 for our elite plus level. It comes with a $100 deductible for the excess coverage. Accident emergency initial treatment physician visit pays in addition to other coverage $100 per visit, maximum 1 visit per covered person per accident. And then you have 4 accident follow-up physician visits that pay in addition to other coverage. They're $100 per visit, again, max 4 visits per covered person per accident. And then finally, the accident emergency room benefit that pays in addition to other coverage. Maximum is $100 per visit, 2 visits per covered person per accident. Real talk: medical bills add up fast. Even with major medical coverage, out-of-pocket costs can crush a family. ER visits today often top 10,000, and that's before things like imaging, medications, specialist visits, follow-up care, therapy, transportation. Most Americans can't absorb these costs, but Better Health helps fill that gap. Here's an example of a claim with a 2-night accident stay where the scenario is a member fractures their leg while hiking and requires surgery plus 2 nights in the hospital. The realistic cost breakdown is the ambulance would be $1,200, the ER visit $2,000, imaging $1,500, surgery $12,000, hospital stay for 2 nights $7,000, meds, anesthesia, and lab costs totaling $3,000, and of course your follow-up with physical therapy $3,000, totaling $29,700. And this is why supplemental protection matters. Here's the Elite Plus option payout for that 2-night accident stay. And your benefits include $10,000 for the hospital admission, $500 for the in-hospital 2-night stay, $10,000 for the accident medical expense with a $100 ER benefit, a $100 initial physician treatment, and then of course 4 $100 follow-up visits totaling $400, with the total benefits paid at $21,100, which is a massive offset against real-world medical costs. And here are 3 examples of how a Better Health Elite Plus option could pay alongside the coverage you may be selling. Example number 1 with a short-term medical is they have a $10,000 deductible, and then it pays 100% of coverage after the deductible's been met. The scenario is a member has a major medical event resulting in a high-cost hospitalization. The member pays the first $10,000 deductible, and then the plan pays 100% after that. Better Health Plan Elite Plus option also pays the $21,100, so the total member benefit is reduced financial responsibility plus cash reimbursement. Example number 2 is an ACA Marketplace plan with no subsidy. The maximum out-of-pocket, or also referred to as MOOP, is $10,600 for the individual. The scenario is the member reaches the maximum out-of-pocket due to a major medical event. How the plan pays is the member would pay up to $10,600, and then the ACA plan pays 100% after the maximum out-of-pocket is reached. The Better Health additional plan payout for the Elite Plus option pays $21,100, so the total member benefit helps cover the high out-of-pocket plus delivers additional cash benefit. And again, example number 3 is a health share plan, with the unshared amount being $6,000, then 100% for hospital confinement. The member pays the $6,000 of the UA, which is the unshared amount. The health share pays 100% of eligible expenses once UA is met. For the Better Health Plan Elite Plus option pays $21,100, so the total member benefit is that it helps offset the UA plus provides significant financial protection. The good news is Better Health delivers big protection at a price families can actually afford. Low monthly costs, high value benefits, real financial security. Beyond all the great benefits and examples we've already covered, members also receive a variety of non-insurance benefits at no additional cost, further enhancing the overall value of their membership. NEA member benefits also include MD Hotline, Tax Audit Defense, Tax Filing Service, ID Recovery Pros, Mobile Device Protection, Good Path Direct, as well as access to Pet Assure members. While all these non-insurance benefits on the last slide are valuable, I want to take a moment to highlight the MD Hotline benefits in more detail. We have recently expanded this benefit to include several new virtual care services, including primary care, dermatology, psychology, psychiatry, and pet health. These new services are offered in addition to the urgent care visits that NEA members have always had access to. Urgent care visits remain free and unlimited, just as they have been historically. The newly added visit types do have a cost, but they provide members with greater convenience, privacy, and flexibility through virtual consultations. It's open 24 hours a day, 365 days a year, and it can treat lots of common conditions such as flu and cold, fever, cough, sore throat, nasal congestion, earaches, weight control, allergies, high blood pressure, and anxiety. MD Hotline, call your doctor anytime, anywhere. This is the MD Hotline website. If your members do not have an established username and password, definitely encourage them to go to neamembersonline.com and click on the MD Hotline logo, create a username and password so that you can actually then log in to the online member portal, which logs you into now what's called the MD Hotline dashboard. Over on the left-hand side, you have several options to choose from the menu, and then of course we have the additional services including urgent care, primary care, dermatology, psychology, psychiatry, and pet health that have also been added. In addition to it, keeps track of your health records, and it also will show the last prescription that you ordered through the service. Here's the association benefits summary, which is available both in the brochure and on the online enrollment page. This makes it easy to reference while you're enrolling your customers or while they self-enroll. Here you can see all the benefit options along with a brief details of what's included, as well as the pricing shown at the bottom. The memberships that most people are buying today would be the Elite and the Elite Plus, and just remember these are basically our Cadillac options for either the 5,000 benefit or for the 10,000 benefit, and it's again $90 for the individual and $190 for the family. And here's our pricing blown up a little bit larger so that you can see it. The billing and effective dates. The bank drafts a member account within 3 business days. The credit card has an additional $5 monthly charge and requires a brief GAC phone verification post-sale. It's very important that you remind your client about it. It will not issue until verified. Effective date on the plan is the 1st of each month. Enrollment forms completed and submitted by the end of the month will be effective the 1st of the following month. The auto draft date is the 16th, and later submissions are subject to become effective the 1st of the next following month. The list bill option for employers is a minimum of 5 to start and 5 to maintain the group. Now here is an enrollment process. All you need is a computer, laptop, or mobile device, and of course an internet connection. You can use any one of these browsers. You simply go to GACQuote.com, highlight agents up here at the top, drop down to agent login, and then click on the blue bar where it says login to GAC Agent Center. Enter your username and password and identify as not a robot, then click login. Once logged in, choose your product links. Click on Better Health Application link that will automatically route you to the quote page. Enter state, gender, age option to add spouse or child, then click Quote Now. Select the option of choice that fits the need on the left-hand side. Complete the enrollment. If the insured doesn't have an email address, click the box indicating no email. You will need to select a username and create a password for benefit fulfillment for member ID card access. An example to use for the password would be password 1%, and of course select and answer the security question. For the payment, select agent if submitting on behalf of the client, complete the payment information, and select the effective date. If you are completing or helping your client complete the enrollment, then you will select completed by agent representative in this section. You are agreeing to the statement of acceptance that you have been given verbal or written authorization by your client to process the online enrollment, including their billing information. If in the future you are asked to provide proof of this authorization, you must have written communication of some sort saved or a recorded verification on file that you can provide as needed. This is the last page of the application. It's the signature portion. You select the effective date and agree to the terms and conditions. Type in their first and last name 3 times as it appears in the corner of the display box. Of course, you can copy and paste the name directly from the display box. And of course, when you're done, you click next to complete the enrollment. It should read, "Thank you." The market is demanding affordable coverage options. Consumers and employers alike are struggling with rising healthcare costs and limited choices, creating a growing opportunity for flexible, cost-effective alternatives. ACA Marketplace plans of 2026, with the out-of-pocket costs climbing to $10,000 for the individual and $21,000 for the family. Of course, short-term medical plans, consumers seeking high relief from costs, going through the roof, with most plans carrying deductibles of $5,000 plus. Grandfathered major medical plans, rising premiums have forced many to raise deductibles and reduce benefits to stay covered. And then, of course, high deductible group plans. Employers continue shifting costs to employees and raising deductibles, driving demand for affordable alternatives. I want to thank you for your time today, and welcome to General Agent Center.